Hi, welcome back to another mini webinar with Dr. Val. Hi, I'm an integrative sleep medicine physician, and here we're going to break down sleeping pills, whether or not you should take them, are there side effects, what are the long term consequences, and really what to do if you struggle with sleep and want to or feel like you need to take something. So, again, even though I'm a medical doctor and on this platform, it's YouTube, I can only provide education in and around sleep. So, this is my disclaimer. If you do have any medical concerns that come up from this, please talk to your physician about it. Okay, so first off, I do want to say that I am not here to pill shame anybody. I certainly, sleeping pills do have their place and it's helpful for you. Fantastic. I think what I really want to provide is just education in and around them because some people think that the only thing they can do to help improve their sleep is actually to take. That's number one. I would say, why do you think you need to take something for sleep? But also, like, what is really going on? If you've seen some of my other videos, I break down, especially for women, do you have a difficulty time falling asleep or staying asleep? Medications certainly can help, but they're not really a cure all. And really, when you take a look at sleeping pills, the way I like to describe them, similar as I do for pain medications, right? You fall and break your arm, your bone is sticking out, unfortunately. It's super painful. So you go to the emergency department, and we're going to give you medication for that pain. However, does that pain shot improve that bone that sticks out? No, right? They're going to call the orthopedic surgeon. They're going to like reset the bone, bring you into surgery. And so, similarly to people who have a hard time, are struggling with sleep, that sleeping pill can help relax your brain waves. It can work on different neurotransmitters to help improve your sleep. However, if right, sort of like the bone sticking out, if the true cause is, say, something like untreated sleep apnea, where your tongue is collapsing and you just can't get good quality sleep because you're not breathing well, is that pill really doing you any service? So I'm gonna categorize this talk in terms of, sorry, categorize the pills into different formulations, meaning there's some that are prescription, some that are non-prescription, and then into some supplements that we'll talk about. So, really, the big bucket of sleeping pills that are prescribed for doctors are the Z drugs, which are newer generations of the benzodiazepines. So, anti anxiety medications work on this system called the GABA system, which is the sleep system in your brain. And it can help relax you, make you feel calm, and ideally make you feel asleep. Because oftentimes we have a hard time sleeping because our brain just wants to keep going and going, or we have anxiety that's uncontrolled. So, the benzodiazepines, they end in Pam, so like diazepam, um, lorazepam as a common one. And the problem with these medications is that they can be very sedative and also addicting. And something that we do know is in elderly folks who do take this, it has been associated with dementia. Actually, a lot of sleeping pills in general have been associated with dementia, increased risk for falls. And sometimes you develop a dependence on this, meaning like if you take it for a while, your body just needs more and more to have this similar effect. Yeah, and really, when you take a look at the medications for sleep, they really were only made for short term. If you're on it for months on ends or even years, and maybe you're not having the greatest quality sleep, even though you take that, may be something to consider. Is there something else that you can do to improve your sleep quality? Yeah, so lorazepam, diazepam, Restoril, that's temazepam. Sometimes these sleeping pills can act really long and they can be in our system for quite some time. So that may be some concern as well. Is it causing sedation through the daytime, which you don't really want to have if you're going to work and driving and things like that. The newer generations are the Z drugs, zolpidem, zolpiclone, acipiclone, right? Ambien is the name brand. Work on similar sort of the non-GABA, sorry, it works on the GABA, but they're considered non-benzo, similar type, they're sedative. However, they are associated with complex sleep behavior, sleepwalking, sleep talking, I've had some people, actually, unfortunately, one lady told me she was driving and she had no recollection. She went to her local mini mart, bought a energy drink, came home, didn't know how she paid for it, and it freaked her out. So she never took another pill again. Other people have cooked on it. So it's quite scary if you're going to take it. Make sure someone's at home to be monitoring you if you do have this. And it's really interesting because this is the first medication that the FDA actually had a ruling where the dose should be adjusted for women, meaning a lower dose adjustment as compared to men. So, yes, we do process medications differently. And then Ambien specifically, women should be on a lower dosage. Um, yeah, and it's really not recommended for long-term use, similar to benzodiazepines, has been associated with some cognitive impairment, so it can affect your memory. Trazodone, this is one is so interesting because it's actually not FDA approved for sleep. It's an antidepressant at lower doses, may have some effects like Benadryl, so like the antihistamine effects. And for some people, it really works because if you're treating your depression and maybe some anxiety, it can help improve your sleep quality. It's generally pretty well tolerated and it's not associated with a specific risk of dependence. However, it can really make you feel drowsy. And some people dissociate with something called priapism, where you can have an erection for an extended period of time. And dizziness, dry mouth, headache are also causes of it. And so, are side effects. So, again, it's a commonly used antidepressant to treat insomnia, to treat people who have a hard time sleeping. If it works, again, good. But at the same time, if you're on it and it's not helping, don't double or triple the dose. Look for something else that potentially can help. Other commonly provided medication that is FDA approved is called Doxin. And so, again, it's an antidepressant. So, antidepressants can improve sleep quality, and it also has some antihistamine properties to it. It has been shown to help, especially in folks who are elderly, because we want to get them off those benzodiazepines, and it's supposed to be non habit forming. So, that's a good thing. But since it works sort of from an anticholinergic standpoint, if you already have issues with like prostates or bladder, you may want to be careful with that. You can have urinary retention. It can cause some dryness, constipation, and blurred vision. Yeah, so doxepin is sort of my go-to medication if I needed to give something for someone who's elderly and we tried a bunch of things, maybe something to consider. The trade name for that is called Silenor. Another medication, sort of a newer medication, is called Belsomra or suvorexant, and it's an orexin receptor antagonist. So that's just a basically orexin is a protein that promotes wakefulness, and if you block where that orexin is able to connect to, it makes you feel drowsy, right? So it blocks the action of orexin, and it's a newer medication. I mean, it has been around for a while. It's still pretty expensive, so I don't have a lot of experience with patients being on it. I can tell you I've had patients on all the FDA approved medications, stimulant, I'm sorry, over the counter medications, and still have a hard time sleeping. So if you are one of those folks, I would say, find a really good therapist who can help you with cognitive behavioral therapy or get a sleep study, because that actually may be the cause. Yeah. Belsomra is supposed to be non-habit forming. It may, right, not be associated with dementia. It's newer agent, so we don't have like all the long-term data as we do for things like Ambien, but it doesn't work on the GABA system, so potentially. Another one see some psychiatrists provide to patient is a medication called Seroquel or quetiapine. That's the generic name. It's really sedating. It's actually an antipsychotic, and it works on different neurotransmitters called serotonin and dopamine. And it can help stabilize the mood again, right? If you have a hard time sleeping because you have a mood disturbances, anxiety, depression, this can help. But one side effect to note is it can cause a weight gain. So I've seen people on this, has treated their issues with psychosis. However, now they've developed sleep apnea because they've gained a lot of weight for it, and definitely not first line treatment for insomnia. Yeah, so those are probably the big buckets of prescription medications. Gabapentin, I've seen a lot of information on the internet about using gabapentin for insomnia. Really, it may be helpful if you have restless leg syndrome, another condition called periodic limb movement disorder. If you have neuropathy, that's like nerve issues, it may help. It's sedating, but it can also have some side effects and be hard to get off of. So, another thing, talk to your doctor about it. As always, talk to your doctor about what's best for you if you are going to take something to improve your sleep. So, let's talk a little bit about the over the counter or maybe with natural sleep aids. So, Benadryl, what's another one? Uh, I'm blanking right now. There's another one over the counter, doxalamine that a lot of people use. Antihistamines, yeah, are very sedating, but they can cause a hangover effect the next day. So sometimes it acts a little bit, works a little bit too much. A lot of people take like the Z-Quil or like the Tylenol cold and flu because it has that. Again, maybe helpful short term, long term, probably not the best for your brain. A lot of people talk about using magnesium for sleep, which is, if it helps, good, because there's a lot less side effects than some of the prescription medications we provide. It may help for those who have like restless leg syndromes or like, sort of Charlie horses or cramps in their legs because it can help with muscle relaxants. But sometimes it does cause a lot of GI issues. And some of the research shows it's not really a quick fix and may take time to see benefits. Again, just like with any other pills, if one pill isn't helping, don't double or triple because more isn't always better. I have seen folks who sort of like overdosed on magnesium and had some really strange like neurologic symptoms. So definitely don't recommend it. L-theanine is something that a lot of people are talking about online as well. It's actually found in green tea, extracts of green tea. It's said to promote relaxation and reduce stress without having that sedating type effect. Pretty well tolerated. Cons though, it may not be as helpful for someone who has like an underlying insomnia. So some of these like herbal type medications, supplements just may make you feel drowsy. But if your brain's still going and going, or if you have untreated like PTSD or anxiety or depression, it may not necessarily help. Melatonin, I have a whole video on melatonin. So if you want to check that out, please do. It really is a natural hormone that regulates sleep and wake cycle. Some studies do show it actually can improve your sleep time. But it really depends on the person taking it. So typically, people who are older, above 55, have decreased release in their melatonin. People who do shift work or jobs or any circadian type issues, it may be helpful. There are side effects from it: increased vivid dreams, even lower blood pressure, some GI upset, and then feeling hangover or drowsiness during the daytime. Again, it's not a cure for insomnia. And so other ones that sometimes that I like to recommend are passion flower, hops, oral lavender, chamomile. Again, can help make you feel relaxed. But if you really have an underlying medical sleep condition like sleep apnea, a circadian rhythm issue, restless leg syndrome, please talk to a healthcare professional doctor about it because these pills really can help make you feel sedated but may not be treating the true cause, right, of your sleep disturbance. So, yeah, a lot of things to consider. And if you need help or want to learn more about women's sleep, you can sign up for my newsletter. The link is below. And we also have a community of women in midlife and perimenopause and menopause who are looking for better sleep. And the program is a Sleephoria Sisterhood. So, link is also below. If you have any questions or concerns, put them in the comments below. Until next time, sleep well, ladies. Bye bye.